G'day there, Hivers. Jono here for a lunchtime live stream. It's the 30th of July as I'm recording this. This particular presentation is about practice pricing, and the reason that I'm doing this is because there's a lot of conversation going on online that I see in groups about how much we should charge. And there are some practice owners who are saying, oh, that person over there is price gouging, they shouldn't be charging that too much. And there are a lot of other people who are really, really bullish about putting their prices up. And I just want to add a little bit of context for what you should think about in order to get the right pricing for your particular situation. Now, it's not going to be the right price for everybody, but there are some certain things that you can go through as some exercises in your practice to work out, okay, what is our ideal pricing? Because essentially when we're thinking about pricing, what we want as the end result is for the price that you charge to match the value that you deliver in the mind of your patient. So I'll just say that again. Your patient has a perception of value. What you want to do is to make your price match whatever their perception of value is. And that's quite different depending on the various different elements of what you involve in your whole service delivery and the experience that you provide for your patients. So I'm just going to share a presentation that goes along with this. And what you'll notice is that it's a thing that I always find people answer when I ask this question, what's the biggest challenge? And they'll say more patients. And I will always challenge that, because if more patients is the answer, you potentially just have to treat more. Now, of course, sometimes that is if you're in the starting out situation, or if your calendar has a very, very really low utilization rate, then more patients, sure, might be the answer. But for a lot of people that we work with, it's not more patients, because your diaries are pretty full. So you can either treat more, you can spend less, or you can charge more. And this is where the pricing part comes into the part of it. And what we talk about is this practice percentage pyramid, and making this work with all of the little pieces of the jigsaw puzzle that make up your business model. And that's the property, the people, the pricing, the product, and the patients. And ideally, when we're looking at the results that come from getting this jigsaw together, we're looking to try and get something where your practitioner salaries can be under 40%, your other costs can be under 20%, your support salaries are somewhere between 10 to 13%. Again, rent and support salaries 20%, which then gives you a 20% net profit on the top of that. Hopefully you can actually keep $10 after paying tax and reinvesting in other stuff in cash back to you. So the question I always ask when we're thinking about model is, will our model work if our practitioners are 75% utilized? Now, you can obviously go a lot higher than that. I like to think that, you feel pretty busy if you're somewhere between 75 and 85% full. And if you're 90%, getting up to 100%, you're probably getting a little bit burnt out as a practitioner. Now, there are these two models. You can go for the scale model, where you just have a lot more clients, that's getting more patients. And the problem with that in the healthcare situation is that you have to do less for them. And if you want to charge a lower price, you can do the margin type model, where you see less clients and you do more for them and you charge a higher amount. Now, what are people prepared to pay more for? Well, it's the relationship that you have. And again, most healthcare settings, we are not in a transactional business. If you think of the different types of businesses with these two filters, one, transactional, that'll be things like, your big supermarket, where they're trying to just get a whole heap of product through and they're just having a tiny margin on top. And it's the volume that actually matters in that kind of business. That's the scale type business, your Woolworths and your Aldi. A margin business is increasing the perception and the actual value that's delivered to your clients and you're doing more for them, and hence you can charge a higher price. And that's the relational business rather than the transactional business. And in a relational business, that's most of us in healthcare, right? So we need, as I said, to match the price and the perception of value. Now, here are 3 different business models. Changli is a car that you can buy out of China and ship it to Australia for $3,000. Toyota's a pretty good, reliable car. Rolls-Royce is right at the top. Now, these are all good models because what they've done is that the value of the Changli is low, but they don't charge, so it's a match, yes. A Toyota, probably middle of the road in terms of cars, middle of the road price. So yes, it's a really good model because the value and the price match. Rolls-Royce, good model, very high price, but perception of value for the product and the service is very high as well. Question I ask you is, where does your practice sit? Now, the problem is if you are charging a low price and providing a high level of value. The reason that doesn't work is because you'll get burnt out or you just won't make any profit in the practice. So again, having this match. Now, what I know is that most people feel more comfortable in providing the high value, and they struggle to, if they wanted to have a low value, low price practice, they struggle to provide low value, doing 10-minute appointments, just churning patients through, churning them through. And if that's you, that's fine as well, I guess. But I know that that's not a comfortable fit for a lot of healthcare practitioners. So what they often fall into the trap of doing is the low price and high value. And it's not a match and it doesn't work. And I do this exercise and I ask around the room when I'm presenting at workshops on pricing, and what you'll notice in here is that there's a massive difference between, like $1,000 here and, $150 here. There's same kind of things that we're doing, whether it's physio or pod, you're fixing particular problems. But often I will be in a room and I'll know there'll be one practice that has a particular type of appointment that's 2.5 to 3 times more than another practice owner who's in the room, and they are providing the same, or they're aiming for the same outcome for the patient, but very different pricing. So we know that that's actually happening. And here's why. It's because people often fall into this trap where they look at what are we doing and they set the price based on just the product and service. So they go, okay, well, we're doing an initial consult and it's 30 minutes. So we're looking at $90 for a 30-minute appointment. And that's what it is. And they're not taking into account that the patient's experience is really informed by these 2 other things. So write this down if you're watching along. The value equals your product and your service plus the image plus the relationship. It's really key. Whether you know it or not, you already are informing the patient's perception by the image and by the relationship. So I think you've probably all got this side of it down pat. You're experienced practitioners, you know what you're doing, you're getting outcomes. And so I look at where are the opportunities for increasing that perception of value so that you can adjust the price accordingly to match the value. It's possibly in these 2 columns over here. So when we're thinking about the image, I went to a practice a few weeks ago to do a team alignment. They've got a beautiful setup. You walk in, really spacious, lots of natural light coming in, everything's clean, big rooms, it's really well set up. And so immediately I'm walking into that practice and I'm thinking, oh yeah, this is premium quality because they've got a premium setup. So that's what I'm thinking of from a patient point of view. This is already premium as I'm walking in to the practice, and I've already made that decision based on that. There'll probably be a timeline between when they first started looking for a solution and when they've shown up. And there'll be potentially an experience of booking through the website. There'll potentially be an experience of having a conversation with somebody at the other end of the phone. And so all of that is going to inform their perception of value. They'll turn up and they'll see the people at the front desk. Are they smiling? How are they dressed? How are they actually engaging with the patient to start off with? And so this is before anything's even happened in the appointment delivery. And then, of course, because we are not in transactional types of businesses, we are in relational types of businesses, all of this comes into factor into increasing the perception of value. So have you gone to the effort of actually finding out a little bit more about the patient and what their particular context is? Are you looking to uncover the real problem that they're showing up? And again, it's not that the real problem is not the particular pain that they have in a limb, in their foot, in their knee, in their elbow, in their back. The real problem is, what is the effect of having that pain on their broader life? You know, if they're an athlete, it's performance. If they're somebody who, you know, is an older person wanting to have more time with their grandkids, then it's the time or the ability that they have to interact in relationships. That's the real problem. And so you need to be able to uncover that. And this is all part of the relationship. Is there an opportunity to present yourself more as the guide, the educator, the coach, the authority, the critical friend, not just the person on the end of the hands that's doing the manipulation, or the person on the end of the piece of equipment who's actually operating that to provide what's happening over here in the product and service? This is really big, and this is really important in making sure that your patients understand the value. You have got their back. That's what you need to get across. And a big one here is the trust equation. And I'm not going to go into it in great detail, but we talk about trust as equaling the credibility, the reliability, and the intimacy divided by the self-interest. And obviously, in a healthcare context, you can't show too much self-interest. You can't make it too much all about yourself. If you imagine, you know, you've got the denominator and the numerator, this number on the bottom needs to be a low number for the equation to be at a higher level of trust. So you can't have no self-interest. And what I always talk about is that the self-interest that you need to have as a practice or a practice owner is pricing appropriately, rather than parking your Maserati in the disabled parking spot directly outside, or not being interested in your patient. But credibility, that you know what you're doing, reliability, doing what you say that you're going to do, and intimacy in terms of actually taking some interest in what is the knock-on effects of getting this particular problem fixed for that patient. Do you actually understand their broader context and what makes them tick, and why it's important to actually get rid of this particular problem? So that's the opportunity for you, is to look at where can we increase our perception of value on all of these things. Now, I said before that, yes, we can just charge more, but there are two elements to this. You can use that value perception to make a justification for putting your prices up, but it's not just about that. You can also shift your mix. We're having a conversation with a practitioner who works in one of our practices, and they wanted to just do more and more. And what we did was we went through this exercise of looking at their current mix. Now, this was a podiatrist, and they were doing a very high percentage of general treatments. But I just wanted to show you, for you to go through and do this exercise with any of your practitioners, it's not just about saying, okay, we're going to do a 10% increase across the board on pricing. It is also about shifting the mix of appointments. Now, I have a couple of filters, actually 3 filters, and we always use these at the Hive. If you're going to increase prices, or if you're going to do any strategic change in your practice, it needs to be a big tick on these 3 questions, these 3 filters. If we do something different, is it going to be good for the patients? Number 1. Is it going to be good for the team member, number two, and is it going to be good for the business? So that's patients, it's team, and it is business itself. So this is contextual. And I'll just show you the spreadsheet that we worked through. We went through and looked at all the different types of appointments. And again, we got this out of Clinico so that we could be accurate. And we put down, okay, well, and this is approximately what this particular practitioner was doing. And they were looking at, okay, well, how can I actually earn more as a practitioner? And we looked at their contract, and they were thinking, oh, I need a higher hourly rate. However, we have this hybrid remuneration agreement with them where they will get a wage adjustment upwards the more they bill. And so we're thinking, well, what if, the pricing may need some slight tweaks, but let's have a look at the mix. And we'll look at that with two filters. Number one, in your professional capacity, what would really fulfill you in terms of the kind of mix between bio and general and high value, more complex cases? What would that look like? And so we went through the list, and at this particular time, this practitioner was seeing about 20 new generals. And we thought, you know what, we wanted to attract more patients who are presenting with acute pain and look at solving those problems. Now, ultimately, what that looked like was, well, let's aim for improving, or in this case, doubling the number of orthotic scans and fits. And then one of the levers that we could pull there was for that practitioner to start recording some videos on heel pain and talking to the pain points when you have heel pain. Again, that would look more like a solution for them that would end up with patients who would require maybe an orthotic prescription or potentially another high value treatment, maybe a shockwave or MLS or something like that. So that was shifting the mix there from 10 to 20, keeping a slightly up bigger pricing point. But it's, as you can see, what we had to look at was increasing the price in some types of appointments by a big amount, i.e. initial, which was probably the wrong price, going from 90 to 120, and deciding that in this particular practice, it had 45 minutes and 30 minutes and 20 minutes, and we're getting quite a few white spaces of 5 or 10 minutes gaps in there, which were decreasing the utilisation rate as well. And looking to go, okay, we're probably looking to target a few less general new ones per month, and then looking at a few of the high value treatments, particularly the Swift and Lanuna. So again, how do you actually pull your levers as a practitioner? You can do some social media. You can go and talk to people who are potentially referring and explain your interest in this. And so what we ended up doing was looking at, okay, well, calendar utilization was around about 116 hours over a month. And we didn't want to push that up any higher, because we thought, that's not too bad. That was over that time period doing 265 appointments, which is pretty busy, right? But not completely over the top. And so we thought, well, we don't want to do a different, add more. So what would your ideal mix look like? And we switched that around, slight change of pricing, but then a different mix to get the same number of patients, appointments per month, the same number of hours per month. But what happened with shifting the mix towards problems that would eventually end up as high value treatments was that the average effective hourly rate went from what was currently 284 up to 405. And the average appointment sale went from 125 up to 177. Now, that's a 42% rise. It's not a 42% price increase. It is a variety of price increases, big on the initial, big on some of these ones, but not across the board. But it ends up being 42% for this particular practitioner because they have shifted their mix to more high value appointments. So that's a really good exercise to go through with a practitioner, but it's also a really good exercise to go through from the umbrella point of view for a practice. What would it look like if the practice was doing its ideal mix? And again, that leads on to some other marketing tactics and activities to actually make that happen in reality. But having a plan like this, by the way, if you want to grab this particular spreadsheet, happy to share that with you. Just put pricing into the comments underneath this live stream and I'll send that through to you. So hopefully that's quite helpful, that we've got these two things. We've got, you know, charging appropriately, but we've also got shifting the mix as well, and they work in conjunction. And remember that to price appropriately and match the perception, you have these three things to take into consideration, that it's not just the product and service. There's an opportunity to make the perception of value from the patient point of view much higher by focusing on these areas that will feed into the image, and big one for relationship type businesses like healthcare practices, and leaning into the relationship. So again, if any follow-up questions, please post them in the comments. If you want the spreadsheet, type in pricing, and I will see you again next week.